I wanted to start by asking a question that has percolated throughout the morning already. But I wanted to ask each of us to take a moment and reflect upon the fact that, first of all, do we know someone, that might be ourselves or a family member or a patient, who has been diagnosed with something life-threatening like cancer, who came to see that as a blessing? And we heard people today say that. So if you can think of someone that would really characterize that diagnosis and experience as a blessing in their life, just let me see a show of hands. So most everyone, right? And my reflections as a physician working a lot with that kind of population, when I thought about seeing that over and over again in people and thought, what's that about? It really is about what we've been talking about, that in those moments of crisis, people take a second to realign their life to be in alignment with what really, really, really matters to them, right? We've heard this all morning. It's about being awake, being conscious, and living every moment fully, whether that's, a week or a decade or several decades. And that's the gift that comes at those moments. And so our obsession is, how do we actually design to do that earlier? And we've heard a lot of conversation about that this morning. The question that I really have is, can we blow up the way healthcare is designed, and believe it or not, the VA is committed to doing this, and actually design it to do that? So let me share something with you. This is a slide. This is not my slide. I mean, it's my slide, but it's not created by me. I was in a meeting, a Department of Defense and VA meeting, if you can imagine that, and they were talking about how do you transform large systems? How do you drive transformation? And the people that were doing the consulting were showing this slide and said, here's the problem with most large systems. When they try to change, they start from the bottom right of that slide. They start by identifying circumstances that they want to change, and then try to drive large system change by going up that side of the slide. And it doesn't turn out well. And their point was, if you're going to drive large system change as an organization, you have to start with the aspiration of that organization. What does that organization want to be? And then let it drive behavior, which will then impact circumstances. So what I was in the room listening to this, and I got very excited. And I got excited because I went, that's what we do in healthcare. Our whole healthcare system is designed to start with the problem, right? The circumstance we don't like. If you come and see somebody that's trained in the medical model, I'm going to write down your chief complaint. That's how I start. I make a problem list, and I have a plan for your problems. The whole thing is problem-based, find it, fix it. And I thought, this is the transformation we need in healthcare. Best slide I've ever seen for that. We need to stop starting from what's wrong and begin to totally change the conversation and say, what do you want your life for? Whether you have a moment or a decade. What do you want to live for? What really matters? And if we started from that place, imagine what could happen. So because I'm so shy and reserved, I jumped up and I said, oh, I have to say something. And so I shared that reflection about this slide in that meeting. And a couple months later, I think it was about 2 or 3 months later, I was in another meeting, and a woman came up to me who has since given me permission to share her story. And she said, I wanted to introduce myself. I was in that DoD VA meeting with you, and you talked about that slide. That changed my life. I was like, really? Like, wow, tell me more. So she said, well, I have a chronic condition, and I have to see my physician every 3 weeks. And she said, I don't enjoy it. It's a pain, but I'm very compliant. You could just tell to talk to her. She's very type A, and she was a very overachiever in her career, et cetera. She said, so I go and I do it because I'm supposed to. She said, but I left that meeting, and I started thinking, I've never asked myself that question. I mean, we don't usually ask ourselves that question until the end of life, as we've been talking about. So she said, I started reflecting on, what do I want my health for? Why do I want to live? And she said, you know what I decided? This will give you a sense of her personality. She said, in 3 years, I'm going to turn 50, and I decided I want to climb Mount Kilimanjaro. I was like, whoa. I said, really? She said, yeah. So the next time I went to see my doctor, I go in, and he says, okay, let's talk about your labs. That's what we do. We talk about your labs. And she said, no. She said, no, I don't want to talk about my labs. I said, excuse me? That's what we do. We talk about your labs, we tweak your meds, you come back. She said, nope, I want to talk about how you can help get me to the top of Mount Kilimanjaro. And this guy was like, whoa. But kudos to him. Like after a few moments, he kind of recalibrates and he gets her thing. And she said, guess what? She said, now I cannot wait to go to my doctor's appointments. She said, guess what? For years, and she's like this, very high strung. She said, for years, he's been telling me that stress plays a role in my condition. And for years, he's been telling me I should incorporate stress reduction or meditation. And for years, I've been telling him, no way, I do. That's what I am, I do. She said, guess what I do now? I meditate an hour every day. Not so her disease will be better, so that she can live the life that she's now identified. She can get to the aspiration. So 2 or 3 years later, I was in a restaurant, and she was there, and she came running over to me, I did it. I went to the top of Mount Kilimanjaro. And I just love that story because it illustrates how can we do this together in a systematic way, right? And I know we've talked about Atul Gawande, but I did want to read one of his many quotes that I love. Oh, wrong side of this slide, hold on. We've been wrong about what our job is in medicine. We think our job is to ensure health and survival, but really it is larger than that. It is to enable well-being. And well-being is about the reasons one wishes to be alive. Those reasons matter not just at the end of life or when disability comes, but all along the way. So how do we design for that? So what we're doing in the VA, despite how broken the bureaucracy is, it is a system that is committed to the radical redesign of healthcare and to really partner with veterans. And so that's the job I have in that system, which is kind of crazy, but it's very exciting. And we have defined this as whole health. So I loved all the conversation about wholeness, that whole health is an approach to healthcare that both empowers and equips, because we have to do both, right? If we just change the conversation and people get revved up, because now they have a sense of meaning and purpose and aspiration in their life, but they don't have the skills to know how to relax or eat differently or move their bodies, it's not going to work. So they need both the empowerment and the equipping, the skills, to really take charge of their health and well-being. And for what purpose? To live their life to the fullest, right? So what does that look like? So this is our kind of framework for what this looks like in the veteran's life and the person's life. The person is at the center. Their mission, their aspiration, their purpose is at the very center of this model. You see mindful awareness around that because you can't be proactive about your health and well-being if it's not grounded in mindfulness and paying attention. So all of these folks are grounded in the teaching and practice of mindfulness. Then each of these areas of self-care we address in their life and their health together with clinical care. The question that we've had is, okay, this is lovely, but just shoving it into the existing medical model does not work. It's not designed to do this. So how do you redesign what healthcare is to do this? So we've really said, you know what, going back to Atul Gawande's quote, we've got it wrong about what our job is in medicine. Right now in our current medical paradigm, and I'm going to oversimplify it a bit, but fundamentally, that bottom right bucket, treat, clinical care, that is essentially the majority of what our healthcare in America is, if we're honest about it, right? It's disease management, it's find it, fix it, it's clinical care, it's a clinical care model, and that's what we've got wrong. That's important and we need it, but I really think not very long in the future, we're going to look back and go, why did we ever think that was going to work? That's ridiculous. So what we're modeling, and we've been piloting this and designing this for a couple of years, and now we are doing a large system deployment of this, that there are 3 elements of this future health system. The first is this question and exploration of what matters most, and how do you partner with someone to discover that in their lives? And we have peers that are doing that, not clinicians, peers who are trained as whole health partners. Then once folks are empowered and excited and engaged in their life again, whether they have a day or a long time, Then they work in well-being programs for the self-care, the equipping part, learning new ways to relax, learning new ways to eat, learning new ways to communicate and relate. All those elements of self-care, that has to be done in a different, it's not like how many times does it work if your doctor says, eat less, lose weight, move more, see you in 3 months, let me know how that turns out. Not very well. So the well-being programs are really critical, and then the treat piece. And this is happening now. It's really exciting to see. I mean, it is turning people's lives around, and oh, by the way, their clinical outcomes are better. Oh, by the way, the costs go down, right? Because they are engaged in their own life. This is just to show you that it is happening at different stages across the United States in the VA system. And there's so much noise and craziness about all the other stuff that it's good, actually. One of my favorite phases is you can't have breakthroughs without having breakdowns. So the VA's in a big breakdown, so we're taking full advantage of that and transforming healthcare while nobody's looking. So that's what we're doing. So my own reflections, which are very consistent, I feel very much at home in this group, that as I was trained as a physician, that modern medicine starts with the body rather than the soul, and the mind rather than the heart. And yet we know that the soul and the heart are the doorways to the healing and the health of the body and the mind. So now we're at this amazing place in the history of healthcare to design for that and lead the way. And in closing, I'm just going to show a very short 3-minute video, which is good. I got 3 minutes and 21 seconds left. And the two things I want you to know about this, you may have seen it, it went viral ages ago, but I'm so old I can bring it back. 2 things you need to know about this, true story, and it's in subtitles, so you have to pay attention. So let's see if we can tee this up.
人为什么活着？为了思念，为了活下去，为了活更长，还是为了离开？
去骑摩托车吧！啊！
五个台湾人，平均年龄81岁，一个重听，一个得了癌症。3个有心脏病，每一个都有退化性关节炎。6个月的准备，环岛13天。1139公里，从北到南，从黑夜到白天，只为了一个简单的理由。人为什么要活着？
to make her come back up and take your applause. Thank you. You're amazing. Thank you so much.